So was it kind of the frustration of the m- the experience with someone who didn't necessarily specialize in HS? What led you to seek out a specialist, and then
Mhm.
how did you even find your specialist?
Yes, it was
Super specialist, I should say,
yeah,
because
super
yeah.
specialist. Yeah, I was frustrated with, I guess, dealing with pain. You kind of become numb to it, but I was looking for relief, and I hadn't received anything at that moment, so, I was frustrated, to answer that question, and the more I read, the more I thought to myself, I really just needed someone who was focused on this. And I started to read about doctors across the country who focus on HS. And that got me to, I'm like, we're in Chicago. Like, I know there is somebody who's a specialized doctor for this. And I did come across a specialty doctor. So
And who's your doctor?
Dr. Onajen.
Yeah,
Yeah,
we've interviewed Dr. Onajin on
yeah,
the MD Newsline podcast. She's great.
she is great.
So you just started researching.
Mhm,
Somebody knows something. Tell me about when you first started working with Dr. Onajin. What
mhm,
is the difference when you're dealing with maybe the previous experience that you had, and
mhm,
now you find a super specialist,
mhm.
and you go over there? What was the initial difference in
Yeah, it
whether?
was like night and day. Dr. Onajen was very aggressive. I remember at a doctor's appointment, she's like, she stated, "Tameka, I'm very aggressive with my treatments. If we do not see any progress or any change within a certain amount of weeks, we move right along to the next thing and to the next thing." And what I appreciated about that is I think a lot of times doctors or providers, they, you know, they think that one thing works for several patients. And she was like, no, this doesn't work for you. Let's go on to the next thing. I can't tell you how many biologic injections I have been through with Dr. Onajen because they did not work, and she listened to me, and she's like, "You've been dealing with this for a very long time, and if you call my office or send me a message and say you're in pain, I know that you're in pain. So if it doesn't work for you, then we move on to the next thing. There are other options and combinations that we can try," and I appreciated that.